1 in 4 U.S. households includes someone who suffers migraines, chronic, severe, and sometimes debilitating headaches. But our next guest says he has a breakthrough treatment, and he's brought a patient with him who says it works. Dr. Kenneth Reed is the developer and inventor of 4-lead neurostimulation treatment and medical director for Ascendant Neuro. And Kim Rutherford is one of his patients. Good to see both of you.
Hi.
Thank you.
All right, so this is a new technology. So many people suffer from migraines. How did you come up with the fix?
Well, it's a development of something we've even done before. We originated a procedure somewhat like this back in the 1990s, but about 4 years ago, we felt that it would work best for migraine headaches if we would apply what we term a 4-lead system to certain nerves in the head. Here's the little device that we implant under the skin, over the eyebrows. Kim has it in. When it's turned on, the patient feels just a very mild tingling sensation in their forehead and back of their head, and from certain mechanisms, it effectively stops the migraine from happening. It tends to be a pretty dramatic effect.
It's amazing because, Kim, you said that your migraines were so debilitating you could no longer go to college.
Right the year leading up to the surgery, I had taken a medical leave from a university that I was at in Colorado. 20 years old, had to move home, couldn't work, couldn't attend class. The days it was real bad, I just laid in the dark and stayed in bed.
Wow. All right, so if we look closely at your forehead, we can see the 2 wires that come down here in a diagonal fashion. Now, they go behind your head, and then you have also like a connector pack on your hip, which basically turns off or on the system, right?
Yes, there's 2 wires. They run right here in the forehead, and then they go around the side and up the back, and then they all connect in the back and run to a battery, which is in the hip. It's all under the skin. You can't see it. You know, I really have to point it out to people in order for them to be able to even see the wires. You wouldn't even know it was there.
So, doctor, she says that she doesn't have her system on 24/7, although you could. If she starts to feel the effects of a headache coming on, she can just turn on the device.
She simply turns it on. She has a remote control very similar to a TV set remote control. She can just turn it on, she'll feel the tingling, headache goes away. Often our patients will leave it on 24/7. Most of our patients were suffering from severe daily headaches, so when they turn it on, they tend just to leave it on, which makes it fairly easy. There's not a lot of fuss or muss with this system. It tends to help either way, off and on or on all the time.
Kim, how has this changed your life?
Now I am back at school. I get graduate in December. I work. I never thought I'd be able to finish one, let alone do both at the same time. I'm a very outdoorsy person. I can snow ski again. I can water ski. I have a social life again. I'm not living at home. It's been wonderful, and now for the first time, and since I was 12 years old, I have control over my headaches, and they don't have control over me.
Wow. Doctors, so far people can find this treatment in Dallas and Houston, in those areas. They can learn more by going to ascendantneuro.com, which we will link to foxnews.com.
Great, yes, absolutely.
All right. Well, thank you so much for sharing your story with us. Continued success to both of you.
Thank you very much.
Thank you.